Hey guys, we are super grateful that you are joining us this afternoon and so excited to share how the third stimulus bill can help you double your discounts on health insurance. I am Anna Baker, the Senior Marketing Manager at Vanderbloemen, and I am joined today by Sutton Turner, the COO of Vanderbloemen, and our good friend John Staub, who is the Health Benefits Thought Leader at Remodel Health. So today we would love to know where all of you are from. We love to know what you're hoping to learn about. So drop all of your thoughts, questions, comments in the comments section, and we will open back up for as much Q&A as possible at the end of the session. So with that, I'm going to hand it over to Sutton to get us started with everything
Thanks,
you need
Anna.
to know.
Thanks for pulling this together. I really do appreciate it. And hopefully we can help lots of churches and nonprofits. So thank you. I wanted to first start off, this time last year, we were working through the PPP of the CARES Act, and we were trying to help as many churches as possible. The goal there was survival. We were all in survival mode, whether you're a small business like Vanderbloemen or your church or a nonprofit. We're all in survival mode, trying to help each other out. I feel like that kind of we're in the same situation here. It's just different. And so today we're going to hit really hard on compensation and benefits, benefits being the number one thing that we're going to walk away from here. And what I want to do is I want to set this up first. Okay. William Vanderbloemen, our CEO and founder, wrote an incredible piece back in October and November called The Great COVID Churn. And it was basically talking about the churn in staff of churches and nonprofits that are going to happen and are happening. We're seeing it as a company because Vanderbloemen helps churches and nonprofits find their executive staff. And we're seeing that. And so he really predicted that. And one of the reasons why we wanted to communicate about that is to make sure and to help as many churches and nonprofits to retain their staff. Okay, so right now, if you're a pastor of a church, and I'm going to specifically talk to you, you're either reopening or in some form of opening, or you're reopen, and you're back and you're either meeting in person or planning to meet in person. Secondly, you're trying to retain the existing staff that you currently have. Thirdly, you're basically going through a reorganization because it's a new normal now. You're now having, online church and Facebook Live and these other venues of communicating out. That's a new normal that you're having to go through, and you're having to reorganize your church or your nonprofit around supporting that activity. And those things are going to lead you, okay? If you're a church, you spend on average 52% of your church's budget on compensation. Okay. The average it's 52, but that's 45% to 65%. It's kind of like the range. Okay. We look, and John and I look at this as compensation is built on salary and benefits. Okay. The salary part of that is going to be somewhere around, let's just say 35 to 45% of your total church's budget. Okay. Benefits is going to be somewhere around, let's just call it 12.5 to 25% of your church's budget. Those two things together, again, is more than half of your church's budget. All right. At Vanderbloemen, what we do is we're going to help you with the reorganization, because we do that consulting. Your reorganization, how do we reorganize as we reopen? We're going to help you because we have the best salary data that's available. Okay, we have about 15,000 data points of church salary information that's cost of living adjusted by your zip code and is also brought current through inflation. And so we're able to help you that. And obviously Vanderbloemen is in the executive search business. We help you when you do have a vacant position. But when you're looking at that reorganization, when you're looking at that salary information, when you want to make sure that you're retaining your existing staff. And one of the ways that you retain your existing staff is to make sure that you're paying market for salary. We can help you do that. The other part of that, and which represents anywhere between 12.5 to 25% of your total church's budget, is called benefits. And some churches don't think that you can actually offer benefits, but you can. And so John Staub, Remodel Health, is joining me today. He is a former pastor. He knows what you're going through right now as you're heading up towards Easter, heading from Easter into the summer, and you're doing all of your plans. Okay, he understands the Christian organization, and more importantly, the church. And so I welcome John today. I hope we can help a ton of people, John.
Yeah, I think so too, Sutton. Thanks for having me on. I always love hanging out with you, and I love serving the church together. We've already been able to do great things, Sutton, and it's been fun. I am blown away at the opportunity ahead of us, and I'm really excited to share about it. So,
okay, so we won't go back. This time last year, we had the CARES Act. We have a whole lot of government money that came out in two different tranches for these churches. A lot of these folks already know about that.
Yep.
There's also been some legislation that's come out that's changed healthcare and benefits your business drastically. And most of the people that are on here, we don't follow that. That's not something that we're reading about. That's not something that we're following. So as much as you can, kind of dumb it down for us pastors on, okay, so what has happened? What has created this opportunity? And then tell us about the opportunity.
Yeah, I appreciate that. So the American Rescue Plan is the name of that latest stimulus, the third stimulus. Most infamously on your Facebook feed would be the $1,400 check. So there's a bunch of stuff included in a $1.9 trillion bill. Wow. And so we get to look a little bit at that. And Sutton, if you don't mind, I'm going to share some slides to give us a good frame of reference. And then from
everybody, Anna is offline. Is off camera, but she's looking at your questions, and we're going to answer your questions. So put them in as John's talking. If there's something that you want to ask, put it in, and Anna's going to come back and she's going to ask us, and we're going to walk through those questions and answers.
Love it. Thanks, Sutton. Loading up my slides. Sutton, are you seeing them there for us?
I got you.
Great. All right. So we're going to talk about why the third stimulus matters, what it can mean for you. At the end, feel free to ask any engineering questions or nuts and bolts. I know there might be some of you out there. For this overview, I am going to keep us high level and look at the impact primarily. The main thing I want you to know as we step into some of these details is that you are not alone. This stuff is complex. It just is. And it's okay if you feel overwhelmed, because 96% of all Americans feel overwhelmed. They don't understand anything about health insurance. So that's okay. We can all breathe. Sutton was, when we were chatting ahead of time, Sutton was just saying, hey, I don't know any of this either, so I'll be able to ask questions right away. And so I'm excited to have his voice on your behalf, but feel free, please ask questions along the way. Anna will help us. We've specifically designed it to get into your details, but check out this right here. Okay. Remodel Health and myself, we've been specializing in this particular model of health benefits for a long time now, about 6 years specifically. The change that happened changed our model of health benefits, which was really helpful. We're going to get into what is happening, but look at the impact here. Okay. First, we have before the American Rescue Plan. This is the standard thing that I would have done, several years back. And we look at transitioning from a group to individual. The biggest thing is you have some subsidies on plans. The original savings for this real group, this is a real group in Illinois, about 25 employees. They were only going to save $10,000. I think they were still going to go with us, but it wasn't hugely motivating to, the cost of change. But then we reran the numbers And their new numbers, because of the American Rescue Plan, with a flip of a switch, because if you look down there, now 19 employees are eligible for subsidies in these plans. They're going to save, and they are now customers, $146,000 on their health benefits. And that's without losing coverage, without getting worse plans, without losing their doctors. They're going to save $146,000 this year.
John, first question I have for you.
Yeah.
So you've got, this is a real group of 25 staff members in Illinois. Would this, and you know, we get this question a lot, and I pass it on to you, that there's a church, let's just say, got 2 employees. So can they also benefit by the change in the American Rescue Plan?
Yeah, it's a great question. Absolutely. If you are on a group health plan, especially the traditional group health plans right now are going to be more expensive. Now I'm going to get into a couple different buckets of people that you're kind of mentioning, Sutton, but yes, anywhere from 2 all the way up to large employers above 50.
When I used to be the former executive pastor of Mars Hill Church, we had 380 employees. This would benefit us as well, or the church planner that's out there that maybe just has 2 people on their staff.
Yes, sir.
Both ends. Okay, great.
Both ends. And that's because we're just talking about insurance products. And so, yes, that's a great question. But yes, we can see it. Now, here are the 3 buckets that generally, I don't ever like to just put someone into a bucket, but we're presenting. So we got to at least, hit all the things. First is spending too much. Well, we've seen that regularly. The second is going to be just spending unwisely, maybe the wrong product, wrong type product. And third thing is just not spending at all. I'm going to give you a little bit of data, a little bit of guidance on this, and then we'll kind of show how it's working and why it's working now. I think we all know a lot of this data, but it is important to understand this is why it's good to learn about this. And it might feel like a new opportunity to you. Again, this has been around a long time, but now it's just super valuable for you to know. So traditional increases have been anywhere from 5 to 7%, sometimes 10%, but generally speaking, that's their average. And so individual costs have remained about flat. Let me define some things quick. Your just normal group plan, if you're doing benefits and you just went with a broker group plan, that's going to be what's increasing about 5 to 7%. Individual plans that normally people would just go get it by themselves if their employer doesn't offer it, those prices have remained relatively flat. Okay. And that's what these costs are going to look at, total cost of the product. Now, how do you get those individual plans into a group? Well, that's what I specialize in. That's what we're learning about today. But if you just look at just spending too much, not only are we spending too much, but we're also getting less for what we are doing. Sudden, imagine if you keep giving a raise to an employee every single year, but they keep doing less and less work every year. That doesn't make a lot of sense inside of your org. And so generally speaking, a lot of the national data, this is not specific to the data that Vanderbloemen has. This is going to be some national averages here for healthcare versus benefits. You can see a tremendous discrepancy on 2 things. 3 things actually: cost of healthcare versus the salary increases. It's generally, you're going to see cost of living a little bit, but then deductibles are going up. So you're getting worse benefits for the cost. So that's going to be a lot of you. If you have a benefit right now, the likelihood is you're spending too much because of these new discounts, the subsidies. Second thing is just spending unwisely. And so I want to encourage you with this. Most of the time, a copay plan, those gold copay plans that maybe you just really loved when you first got it, 2 decades ago, a decade ago, really HSA plans will help you save up money. They're going to be cheaper. I'm going to show you kind of how this looks. First, most employers are they're not helping their people with medical expenses. They're just helping them with their actual product, which is not all that helpful because a family, there's gold plans out there. This is very common. There's a national average that a gold plan will have the max risk, like max out-of-pocket limit. There's a lot of phrases. $15,000 for a family. That's the risk that family has. Whereas HSA plans are going to be generally cheaper, lower risk. So that's good. But then look in this step number 2, they're going to have actually cheaper costs, around $10,000 less. So you understand now how we can actually help individuals to help self-insure. And so if you just look here, the way I've kind of broken it down, you can get better plans for cheaper. Now, this is not contingent on those subsidies yet. I'm going to get into that, but I want you to start realizing you're either spending too much, spending unwisely, or you're not spending at all, because this new bill is going to help all three buckets of where you might be. About 33% of people have literally gotten a bill while they have health insurance, and they were not expecting it, and it ended up just totally blowing them up. This is for people that did have insurance. If you're not spending anything on your insurance right now, I have to make sure you know that the number one cause of bankruptcy in the United States are medical expenses. We've got to make sure that we're actively participating, taking care of our people. You don't want something to happen in your congregation.
66.5%.
Yeah, 66.5%
of all bankruptcies is tied to medical issues.
Yeah.
Wow, I had no idea.
Yeah. And so I want to show one more piece of data that I do not like. And this is the number of uninsured Americans, according to the Kaiser Family Foundation, is inching back up again. And so, Sutton, I talk to pastors regularly that they're very well-meaning, or maybe they just can't, they feel like they can't do anything. And I say, well, what are your people doing? And they're like, well, they're just kind of on their own. Well, do you know that they're covered? So anyway, I don't like to be too much of an alarmist, but having been a pastor in two different organizations, one without insurance and one with insurance, I can tell you that the one that helped provide insurance to me, I felt more cared for in those moments. I certainly understand now how much more I was cared for, but I want to make sure and just kind of set you all up in that way. So there's our three buckets. But here, this is now why it matters. And we're going to get into kind of the stories behind this, Sutton. The basics are that there are bigger discounts on plans and even more people qualify. Now, not all plans get these discounts. It's specifically the individual plans that then you take your whole group and you organize it. Again, it's what we specialize in. So this does not apply to your group plan. But these discounts that were already there, they're even bigger and more people qualify. So let's look at some stories. To me, Sutton, working in the church, for those of you who don't know me, I worked in church for about a decade, loved it, full-time vocational ministry. I still feel like I'm in a ministry seat here, getting to serve a lot of churches, and I still love that. But of all the churches and church people and pastors I've worked with, these two stories, they're going to ring a bell for people on your teams, maybe even you. So here's the first family of four. Let's just say they have a single income. Maybe they just had a new child and the mom wanted to stay home, be with her infant. If I've seen it once, I've seen it 1,000 times. They're making about $60,000 a year. Their insurance cost, the cost of their product, is going to decrease by 58% for them. That's incredible. Specifically, when it comes to these insurance products, it's about $221 back into their pockets. Sudden, I got a kiddo on the way, so I just did some research on how much diapers cost per month, just because I was like trying to plan out. And it's about $100 to $150 a month is the current average for diapers. And so this family not only can get their diapers paid for, but they're going to get some extra they could put into savings or anything like that. Here's the tremendous thing. So as I mentioned, bigger discounts for some, but then new discounts, more people qualify for them. These are the subsidies. That might be a word that you've heard on these individual plans. Let's look at this 60-year-old recent empty nesters. Okay. Again, maybe this is your executive pastor. Maybe this is your lead pastor. There are a lot of wonderful older pastors that are out there that if they're trying to find an individual plan, you're all trying to look at it. Because of their age, their cost might have been too high. And then especially when you have kids leave the house, just the way everything's calculated, you don't get any more subsidies. but now they do. So let's say an empty nester couple, 60 years old, making $75,000 for their household income. On their product, they're going to see $16,000 of savings. And so if you're out there and you're just kind of on your own, this does apply to you. You might know this, you might not know this yet, but please make sure and look into that. There are new subsidies for you if you're just by yourself. But these two examples, obviously I'm sharing just the personal story if they were just by themselves, but the cost of those products is that actually employers those discounts can be leveraged to save costs. So now apply that to your whole team. Apply that to your young family of 4. Apply that to your old, your empty nesting couple in their 60s. That's how we can see that $146,000 difference, because it's unlocked in those discounts. The discounts that have just become either better or more because of the American Rescue Plan. And so the basic fact is that those group plans have become outdated and they're more expensive than individual plans. You need to figure out a way to compliantly and in an organized way get your team over to these subsidized plans and these discounts. And so for the nerds out there, I'm just going to kind of flash this screen up real quick, just so you can kind of see.
This is good, because there's going to be some people, some numbers people that are going to want this slide, because this is that subsidy slide. So
these are the two families that we just looked at. These are national averages, by the way, and in case you're wondering, so it will be specific to their location. But originally, there's a lot of percentages that go into this, and I can get into them, but just for the sake of kind of looking at this, the old cost of the product that they were on, this family of 4, was about $379. It was already subsidized. Okay. It was already being discounted to them. That's great. But now you can see that the new cost of their product is actually $158. So that's how they're saving $221. That's the 58% decrease.
That's a per month, right?
That's a per month. Yes. Thank you. Thank you for clarifying that. Now here is the 60-year-old couple. This is the core cost of the product. They had no subsidies before, but now there is a subsidy. And again, how those subsidies are determined, I can answer if anyone's ever, if they're interested. I got some more slides I can show, but you see they originally were paying $19.20 for this, benchmark silver plan. Now they're paying $531. Same plan, same coverage. They just, now it's subsidized because these new subsidies are available, and they're going to save about $1,400 a month. So it's just incredible. So what does this actually mean for group health benefits? I'm going to push a little bit on making sure it's my job as a consultant and a thought leader to be thinking ahead. Right now, there are some big red flags for traditional group plans, and the reason is this. In 2020, Sutton, what were we all doing? Were we going places, or were we staying at home?
We're staying at home.
We're staying at home. How many hospitals were open for non-required procedures? Zero. So all these planned procedures that are regular that we need to have done were not done in 2020, and that are now being done here in 2021 on top of the other things that are already going to happen in 2021. So the cost of insurance is going to be after the carrier, the insurance company, has to pay out. And then they say, hey, we had to pay a whole bunch of stuff. We now need to give increases to our insureds. So the first projection that I saw early on was projecting anywhere from 6 to 10 is kind of what we thought. The latest that I saw, based on individual, they're looking at counties at this point, specifically with self-insured and carriers, they're looking at maybe 18%. So I do want you to, not for the sake of, this has changed, I don't know about individual plans. Yeah, there's subsidies, but we're fine. Not only is there an opportunity ahead of you, the likelihood is that at the end of the year, you're going to get slammed with a pretty significant increase. So you need to make sure that you're preparing. Again, employers can leverage individual plans and unlock discounts. There's key things behind that, but really there are millions of dollars to be regained back into mission. when this law suddenly, it was a pretty fun day working at Remodel Health, which every day is fun if my bosses are watching. But it was a fun day at Remodel Health to be at work when we realized that these new discounts were going to be a reality. And all of a sudden we ran the numbers. I remember our VP of ops, he showed up and he's like, hey, we just ran the numbers, and we just shared it with the team of how just immediately our customers, our churches and our Christian schools and our nonprofits were able to just immediately save more money for their mission. And so I'm going to
what's funny is, and just
go
to
ahead,
give you
Sutton.
a parallel with that, at the end of March of 2020, I was digging, trying to get Senator Tim Scott from South Carolina to respond to my email, because the subcommittee that he was a part of at the Senate subcommittee actually was the one that was leaving fuzziness around if churches were going to be able to get PPP. And I kept on digging. And finally like the light went on. I was like, holy cow, I just got an email back from him. And it says that churches and nonprofits are going to be able to participate in PPP. And I was just like, and because you realize the same thing that just happened with you and Remodel Health, you realize how many Christian organizations are out there that this is going to benefit.
Oh, yeah.
And how many families that are working for one of those Christian organizations are going to benefit. So not only the organization is going to benefit, but the individual pastors and leaders are going to be able to benefit. And that's awesome. It's just a great feeling.
Yeah, it's so refreshing after a 2020 that was difficult. Sutton, I want to share something, and I think we'll probably get into this in the questions. And this is when I was going to hand it back to y'all to get into some questions, because I want this to be meaningful, to talk through things. But one more key detail for churches specifically, Sutton, the discounts on these products will be based on something called modified adjusted gross income. The simple way is it's salary minus housing allowance.
Come on.
And so
that's some good news right there.
The lower your income, according to that equation, the bigger your discounts are. So this is a huge win for pastors.
Yep.
And, there's a lot of tax credits out there. And if you're not taking advantage of it, because that's what the subsidies are, just, the mechanism as a tax credit, you'd be real silly not taking advantage of tax credits if they're out there. You'd be silly not use the PPP if it was out there. So
you're thinking about that, like just a pastor is making $80,000 a year and has a $42,000 a year housing allowance. For this program, that subsidy is going to look like he's making 38, which is going to qualify him for a ton of subsidies. That's awesome. Yeah. That's killer. All right. I want to share my screen real quick before we start questions. I wanted to there's something that John said that I wanted to, there we go. Look at you, Anna. You're so amazing. All right. Can you all see my screen?
Yes.
Okay. So this is the example of the compensation and benefits analysis that we do with almost 15,000 data points now. And the thing that we have done over the last 4 months since you all have seen this is we've always compared the current salary of this senior pastor, which is $102,000, against 50 churches with similar size attendance. Okay. So this is a church of 13,000. So this is the churches between 1,200 and 1,400. And this is where the percentile that current $102,000 lay. Then we can compare it to the budget. The budget is 2.75 million. And so there's 50 data points and it's at the 28th percentile. Here is the difference that we've added. Here is the benefits of comparing this church and this senior pastor to churches of the same exact size and the size, whether it be both attendance and budget. And so the key here, and this is why it's important for everybody to know how you're doing compared to other churches that are the same. Remember, this is all cost of living adjusted. So it doesn't matter if you're in San Francisco or Des Moines, Iowa. But if you may be low, let's just say on your salary, but you're high, you're up here in the 80th percentile on your benefits. And so that's why you need to know the benefits that you're offering coupled with your salary is total compensation. And that's the thing that John and I are working on here together in unison is we're trying to give you more benefits to cost less, and possibly you might be able to spend that money, whether it be on salary or just on mission in general. But I wanted to make that point because we do have an update to the salary surveys and the benefit surveys that we're doing. And if you want one of these, compensation@vanderbloemen.com, compensation@vanderbloemen.com. Send us an email and we'll be glad to help you.
Yeah, that is great, Sutton. You know, as I heard our VP come in and just share the millions that were going back, what I thought, Sutton, was this means raises. Hopefully people start getting paid what they need to be getting paid just right now in the team. Serving employees that you have is one of the most valuable tools toward mission you can possibly do. And so,
or putting that savings in an HSA account, health savings account, to help the employees pay for their deductible, or possibly increasing the quality of the health insurance. Maybe they're just covering the staff member. Maybe they can now cover the whole family. There's so many additional benefits. Maybe it's putting those additional dollars into somebody's 403B to allow them to plan for retirement. All of those things now give you the ability. When you're saving money on those benefits, you can do so many other things. And again, it gets back to where I started. We're in the great COVID churn right now with staff. There's so many people looking for jobs, deciding to move back home, wherever that is, deciding to move different locations, deciding to make a lot of decisions that are not directly related to their professional career. They're related more so to their personal lives, and they've decided to make some adjustments. And you as a church need to make sure that you're a competitive salary. And what John is trying to help you do is a very, very competitive, generous benefits program for your employees. So Anna, let's talk to some questions, if you don't mind. Anna Baker.
All right. We've got a lot of questions, so I'm glad we still have half the time because we're probably going to need it. So let's start with the number one most popular question. How long is this going to last and be available?
Yeah, great. So currently on pen and paper, it is 2 years. It is the 2021 tax year and the 2022 tax year. So that means if you're that group that can save $146,000, you can do that twice for sure right now. What I will tell you is when we look at laws, the wisest thing we can do is to look at history and say, hey, what can we expect for the future based on what's happened in the past? We would fully anticipate this to either be renewed by legislation. There's already committees at work on making this permanent, but at very minimum, that the current administration, the current presidential administration, to renew this by executive order. This would be a very unpopular thing to do in the midst of any election cycle. And in 2 years, there'll be another Senate election cycle. Yeah. So again, pen on paper, 2 years. We certainly expect 4 years. Beyond that, we're going to see any party that removes this now. Will it's tough. Everyone's going to be in a tough spot at this point when it comes to taking it away. But again, hopefully that answers the question as specifically as we got it.
Awesome. Thank you.
Yeah.
Let's see. So Barbara wants to know what information is required to determine if moving from our group plan to individual plans will save the church money.
That is a great question. And what I would recommend is to get connected with one of our consultants. And you can do that through remodelhealth.com/Vanderbloemen. remodelhealth.com/Vanderbloemen. And it's a really simple process. We've got a simple census file, and our team is great. We'll keep it as painless but as meaningful as possible for you. There are going to be some key data things that you'll have on hand, and we can run a quote for you pretty quick. And so then you'll be able to see, does this make sense or is something else?
And John, I want to point out something. Being an executive pastor of two different churches, both times that I joined the team, the staff of both those churches, they had existing benefits, and both times they were being provided for. A member of the church was the agent for the health insurance, and one of the things is there's some. And it was my situation to where I had a kind of I wasn't able to bid out my insurance because I felt like I was betraying the trust of a member. When you're contacting Remodel Health, there's no obligation to go with them or anything. They are literally, it's kind of like if we had a storm damage here with my roof, and I called out two different roofers, and I compared the two bids on replacing my roof. This is what John's going to do. He's going to send you what it would cost for them to do the thing. You have no obligation to go with them, no obligation for Vanderbloemen. We're just trying to help the church and nonprofits to save as much money as possible.
Yeah, and thanks for that. So, there's been plenty of times, especially with churches, and how many well-meaning, just good-hearted members or board members, and they say, hey, you know what? I understand I've been doing this for you for, 10 years. You've got to go over to Remodel Health because this, at least for the next 2 years, probably 4 years, we can turn the corner as a church, or we can get enough money to finally build the building or hire the staff member. And, you don't be so afraid that when there's opportunity like this, the good people in your church, they'll support you. And in fact, bring them along with you to look at this, because it's a great learning opportunity to make a big impact on the mission.
Awesome. Thank you both. A great question that we just got in is, how do we exit a current health plan in 2021 to maximize the benefits?
Yeah, that's great. So you can change it anytime this year. I'd recommend if you're going to change, if there is savings, don't leave money on the table. In addition to that, there's this idea of how deep into your deductibles are you? And so if you have one or two employees, or maybe even you, and you're like, we've already met our deductible, like, I don't want to change plans. When you have this kind of savings, there's a way to help people out with their deductibles in one-off compliance situations while not making the church forfeit all of this savings for the sake of a couple people that have hit deductibles. So change now. You're able to do it. It's not hard. And the whole specific tactical thing of exiting your plan, that's real simple. So we don't even need to get into it, Anna.
Awesome.
Yeah.
All right. Another pretty popular question is, where are the subsidies coming from?
Yeah, great. So these are advanced premium tax credits. Okay. Advanced premium tax credits. You can go to remodelhealth.com/resources. We got a bunch of stuff there. Just go to irs.gov if you want some very light reading. But advanced premium tax credits, the way that it works is when an individual goes to shop on the marketplace for a plan, they type in all their information, and then what they see is a discount. Let's say the product was originally $1,000, but now to them it's $250. Well, what's that discount? Well, what's happening is the carrier takes that application, sends it to the IRS and says, hey, this individual is purchasing this plan. The IRS sends that tax credit in advance for the premium to the carrier. And so then it does true up on the IRS 1040 at the end of the year. It's, pretty simple process, but yes, these are tax credits from the IRS going directly to the carrier to discount the product. And it's in advance. It's not at the end of the year, like a child tax credit. It happens every single month to the carrier.
Awesome. Thank you so much. All right. Are you ready
I
for a
actually
little?
understood that.
I was looking at you the whole
I
time.
actually understood that. I'm like, holy cow! I know what he's talking. I know what you're saying. This is good.
Well, good,
And
good.
you said IRS in a sentence, and I actually understood what that meant.
Look
So
at
it's
that. We're
good.
making experts out of all of a sudden.
Yeah, if you ever need light reading, Sutton and John are your go-to guys. They are so good at recommending reading for all of us.
Well, you do it because you love people and you want to help them.
That's right. That's right. That's
There
what
you
it's all
go.
about.
Dedication. Okay, so some rapid fire because we have some kind of specific questions, but I'm sure they apply to multiple people here. So let's see. First of all, is this targeted for small groups and not large group employers?
Great. Sutton kind of asked that. I'll answer it real quick. No, this is for all sizes, even above 100. In fact, our biggest wins. I mean, there was one group that saved $1 million doing this, and they were well over 100. So yes, it's for all sizes.
And
Awesome.
let me say this again. If you are a small church, which most churches in America are very small churches, and you might have 1 or 2 or 3 staff members, and you think that your staff is not big enough to afford health insurance, please reach out to Remodel Health, because like you going from having 0 benefits to providing benefits is a huge retention for your staff. So please at least explore, send the email, fill out the information. If you don't think that you can, at least go through the steps to verify that your assumption is true. Because most of the time when I have sent people with those types of situations to Remodel Health, they've been covered.
Yep. Awesome. What about Christian Camps 501c3?
Yep, everybody. That works.
Everybody.
And in fact, if you're a Christian small business owner or just a small business owner in general, I know that most of the people here are going to be Christian organizations, but yes, this works for everybody. It's not just limited to churches, not just schools, not just it's even for profit. We're seeing huge wins now. Awesome.
So you briefly touched on this, but can you talk again about how employees can qualify for subsidies?
Yeah. So what this has to do, and I am going to share my screen really briefly because I think that the visual aid does work. And in fact, by the way, I'd be happy to send my full slide deck to anybody who would be interested in it. This is all public information. And so I'm happy to share that with any of you that might be interested. Let me see here. Do you see my screen now, Sutton?
Yep.
Okay, the first thing is a calculation for FPL, federal poverty level. And so this is that income level that you're going to be contingent on. For example, on the bottom, family of 4, if they make $79,500, they're at 300% FPL, because if you look at the number 4 and you go over there, 100% would be $26,500. Okay, just hang on with me. Then what you have is you have a spend limit against the silver benchmark. So FPL, spend limit, silver benchmark. So the spend limits are going to be kind of, they're going to range. And what that means is a family is only expected to pay a certain percentage of their income for this benchmark plan. And then the tax credit pays for the rest of that plan in the equation. Now, what happens though, is that subsidy, you can spend it on any plan. It's just that's how they calculate the subsidy itself. And so now the way that these percentages are looking, and for the math people out there, this might be really, really cool for you. You're going to see that a lot of people anyway, from 100% to 150% FPL, they're going to spend nothing. That means their expected costs are 0 for the silver benchmark. But then even all the way up to the 300%, it's just 6%. And then the new eligibility is going to be the 8.5%. And so, so this is kind of how the qualification happens, where they're going to pay a certain percentage and then they get the subsidy. But those subsidies can be spent on any product that they might want. And Sutton, guess what? Most of the HSA plans are cheaper than the silver benchmark plan. which ends up meaning that a lot of people can get at $0 premiums. They can get into HSA plans. The church can just load up their HSA accounts. And we've seen this now. Churches that have had a really healthy group 2 years in a row, and after year 2, they have fully insured families with $15,000 of HSA in the bank. And so if they have a worse year, they don't pay anything. And so that's about being smarter. So there you go. That's the answer.
Awesome. Thank you. So where can people reach out if they want to receive your slides?
Yes. So what you can do is feel free to go to Vanderbloemen. I'm going to show just the slide right here. Let me get this going. There we go. Go to remodelhealth.com/Vanderbloemen. Any of y'all that go there and submit your information in that form, we will send you the slides. As Anna mentioned, we're going to have this video available as well. You can email me at john.staub@remodelhealth.com directly, and I'd be happy to just send you the PDF. I won't even make it schedule a meeting with me, but even you should talk to me, but I won't bother you too much.
Perfect. We have a few more questions.
Yeah.
So one, David wants to know, is this access through Obamacare?
Yeah, so Obamacare is one of the terms used for the Affordable Care Act. It was signed March 23rd of 2010, so it's 11 years old. The Affordable Care Act and Obamacare has jurisdiction over all health insurance. And so most of the time people think that Obamacare is just individual plans, but if you're on any insurance, you're on an Obamacare plan because it requires, the 10 essential health benefits and minimum essential coverage. So we're all on Obamacare now. It's been here for 11 years. These plans that I'm referencing are the individual plans on the marketplace. Individual plans have been around for decades. And so they were shored up quite a bit. They are the only ones qualified for the discounts. They're guaranteed issue plans, which are super helpful. And so, yes, they are Affordable Care Act plans, but I always like to educate in that because most people think it's just individual, but really it's all Affordable Care Act at this point.
So Nathan is asking if the discounts are already being provided to the individual plans, what's the benefit to the church for grouping the plans together?
Yeah, that's great. So here's the thing. If you are on a group plan, you're not getting the discounts. If your team is off by themselves, you think they have coverage, but they don't, or they don't know how to navigate it well, that would be the only way your team would have those discounts right now. And they might not even be aware that they need to go in and reprocess their application to get the new discounts and stuff. So if your team is on individual plans right now, you really need to make sure and organize it with Remodel Health. You really do. And if you're on a group plan, they don't have access to it anyway. So hopefully that answers the question.
Brent is asking for you to speak to those who might see this as a lot of work or upheaval with a large number of employees transitioning and why they should consider doing this.
Yeah, that's a really good question. Health insurance is complex. Our goal is, and I haven't even shown any of this, my goal has been to educate. If I was to do a full demo for you for how we keep it organized, you would love it. And so we have a proprietary software actually with Remodel Health. We organize all these details. We got a shopping experience, an admin portal with resources. I mean, everything. So I'm not going to do a commercial for us any more than just that. But we keep it organized. That's what we do. That's what we're passionate about. It is a transition though. And so it is a paradigm shift in the way a lot of people do think. They usually just want to show up at that boring, it's the most boring. I'm in insurance. It's the most boring meeting all year. Give me the paper, I'll sign it, give me the card. But really, with the state of health insurance, we need to make sure we're providing meaningful education to people. And that's what we do as well. We have coaches that are ready to walk alongside your people to help them know how to learn along the way. But here's the reason why you do it. Again, this group of 25 saving $146,000. Again, the large employer that I was mentioning, there was upwards of 300 saving over $1 million. That's why you do it. You do it to make sure you're being a wise steward of resources. at this point, in general, there's a couple anomalies. If you're doing an old group plan, you're overspending and you're wasting money on something that is this. You can help your people better, and you can get more resources into their pockets, into the mission of your church.
Good.
Awesome. Thank you, John.
Yeah.
Does the structure of these individual plans allow for HSA contributions from the employer as non-taxable income?
I love that. And the answer is yes. Simply yes. And also,
Yes.
please
Short
do
and
that. Yes, and please do that.
Love it. Okay, switching gears a little bit. When you say 52% of budget is compensation, and that includes payroll and benefits, does that include employer payroll taxes too?
Yes, it does. It's your total payroll costs, and those range based on our data and also based on the leadership network data from 2018. But our data also of now 15,000 churches or 15,000 data points is exactly that. It's between 45% and 65% of your total church budget is payroll, and that includes benefits and salary and taxes and everything together.
Awesome. Thanks, Sutton. Can the employer or church still fund HSA accounts for employees?
Yes, and that's similar to the last question as well. Yep, absolutely. Please do. And I'll answer this question. It hasn't been asked yet. You can actually bolt on a group HRA on the very back end to help with exposure in that way as well. So for those of you, it's one of those things, if you know, you know. If you don't know, then it's too long of a conversation. But if you're wondering and you haven't typed it yet or it's in there, yes, even HRAs, you can bolt onto this model.
Perfect. We just got two questions. How does this relate to self-insured plans?
Yeah, great. So self-insured plans, basically you are the insurance company is really similar idea. You have something that you put on like a backstop insurance that, hey, if claims get way too high, that insurance kicks in. And if that insurance kicks in, it's real bad. You don't want to be the insurance carrier because you can't get discounts on a plan that is you. These plans are getting discounts from tax credits that are insurance companies. So the insurance company takes the risk, the IRS tax credits help pay for the plans, and then you get to make sure and keep it organized.
Yeah. So if you're self-insured, you cannot participate in this plan.
No, and you should change over to this model if you can. Now, I do understand there are actually some details of self-insured plans on runoffs and how long you can actually take to renew and all that. Self-insured is a very sticky situation because it works great for about 2 or 3 years and then you got a bad year, but it's also termed. So you're in a contract and everything. So if you're coming up on the renewal for your self-insurance, you really need to make sure and have a conversation right away to just see if that makes sense. Because if you renew that self-insurance, you are going to be stuck. So that's going to be one of the stickiest parts of all this. Those are usually large employers too. So
can we take 2 steps back, John? I want to clarify something and make sure that I'm understanding something correctly. Let's say that we're a church, kind of like your model, your example, which was 25 staff members. And let's say that church is running 1,800 on an ongoing weekend, and so they're almost a mega church, right? And they've got normally in a staff like that, they've got probably 2, if not 3 executive level staff members. Got a senior pastor, got an executive pastor, maybe a senior associate pastor, let's just say. And knowing salaries, we've got those 3 people would be over $100,000. However, the remaining 22 employees most likely are going to be less than $75,000. And one of the things I was thinking about, if they are pastors and they do get a housing allowance, okay, their total taxable income total taxable salary is a lot less. And so you might have, of a church of 25, you might have, I don't know, 17, 18 of those staff members at the lower end of compensation. A lot of them are, so let's just say some entry level positions, etc. And so the subsidies for those lower paying job really helps that church participate in this new program. And so I kind of wanted to give an example, and I want to make sure that I'm thinking about this correctly, is that the people that are on the lower end of your payroll are the ones that get the highest level of the discount.
Yeah. So absolutely, they're going to see the lowest cost of their products because the lower your income. What I will say, Sutton, is that this particular model over the past 6 years, the person who didn't get any discounts was going to be maybe a business pastor that didn't have a housing allowance. And so they were making over 100,000. They didn't qualify for subsidies. They were over this threshold.
Right.
That threshold has since been removed. And so generally speaking right now, monetarily, we're seeing those new discounts being just as significant as then the increased discounts for the people that already had subsidies. And so it really is a win-win on both ends of the spectrum you mentioned. But especially if you're having employees pay part of their premium, this is really a way that you can, at least for, a few years, just remove their cost of participation, because then you can make sure that you're really blessing them. You're basically giving them a raise without it going, you're making a raise by lowering how much they have to spend.
Well, so here's the key. So my data shows of the churches that participate in our compensation, a third of the churches provide health insurance for the entire family. A third of the churches provide insurance just for that staff member. And a third of the churches do not provide any health insurance whatsoever.
Wow.
So if let's just say that you're in that middle group, which is the church is providing for you, but you have a family, so you have to take salary dollars out of your pocket to buy the rest of the plan to provide insurance for the rest of your family, that individual might be hugely beneficial or benefited by this new plan.
Well, and you want to know something, it's because of the way that the ratios work, Sutton, is that actually the more individuals you add to a plan, even keeping the same income level, the more individuals, it makes that FPL ratio go down, which means then the discounts end up going up. And so individual plans based on the individuals makes it, not only are you going to have savings that you can dump into those families and help care for them better, but really you're not having to spend that much more, because group family plans are super expensive. Individual family plans are actually deeply discounted because of the way that the ratios work.
Right. And so, Anna, I just saw Misty's question, and she was asking, is this only for nonprofits? This is not. This is for every organization, small business. This is not. Now, Vanderbloemen, we serve churches, nonprofits, and Christian organizations, and that's why you're hearing me use that language. But this applies to every small business out there, and even large business that's out there. So this applies to the swath of America. So
that's true.
I think that's our time, guys.
It is.
Anna?
And so if you want to request the slides, you can go to remodelhealth.com/Vanderbloemen. If you want to rewatch this recording, you can just come right back to the same link and you can watch it as many times as you want to. You can pause, rewind, zoom in, whatever you need to do. If you want to contact John, he is john.staub@remodelhealth.com. If you want to talk to Sutton, he is compensation@vanderbloemen.com. And hopefully that is all the information that everyone needs, and that you know where to reach us now. Thank you so much for coming, and we hope that we helped answer lots of your questions. Thank you, John and Sutton.
Yeah, thanks everyone.
Thank you.